Morning, ladies and gentlemen. Welcome to another episode of Monitor Your Health, the program where we educate the public on contemporary medical conditions. This morning is going to be a completely different, portal or presentation. Normally, we have a guest in-house that we'll discuss with and ask questions. But today, I'm going to be on my own. And I feel that we should actually utilize the time. I've thought about a topic I can actually discuss that we can all benefit from. And what just popped to mind is something I think is a bit common and it frightens everyone. So in the next 10, 15 minutes, I'm just going to talk about, what we need to know about chest pain. Okay. So chest pain is something that is quite, worrisome. A lot of people get panicky when they have, any pain in their chest. So I want to quickly just, dabble into it and, advise us on things I think it's important to know about it and how we need to manage cases of chest pain within our own space if it ever happens. Now, any area of the body where there's pain, obviously something is wrong because pain is not normal, in our body. So if we look at the part of the body where the pain is, we can almost, in most cases, say that this pain is related to certain things or the other. So when we talk about chest pain, is the pain that people have in their chest. And your chest cuts across, obviously, from the root of your neck up to where your diaphragm, which is the organ that helps us in breathing, where it hangs. So any pain along that side is called chest pain. Now, let's look at the anatomy of the area. Let's look at what we have in that area, and then that can point us in direction of pains that will be worrying or pains that, we don't need to worry too much about. Obviously, don't get me wrong, any pain in your body, you must get somebody to see. But the question is, the pain you're having, do you need to get somebody to see it right now? Or is it something that we can wait, for another, a few hours or maybe later on? So this is how we get to know, okay? Let's look at the anatomy of the chest. From outside, if we're looking inwardly, the first thing you see, if I strip off, I'm not going to do that. But if I strip off now, obviously you will see my skin. So my chest will start from where you're seeing there, which is you see my skin. So from the skin, underneath the skin are some, subcutaneous tissue. These are just like if you ever had skinned a chicken or a goat before, you will see the skin. Then you see this whitish thing underneath the skin. That's the subcutaneous tissue. And that layer also, anything can be wrong in that area where you can have pain. And then if you then go further from the subcutaneous tissue, then you'll be getting into area that is a bit thick, and then that's where you have your muscles and the different types of muscles that covers the chest. Because the chest is a very, very important area in our body. There's so many organs there. You have your heart, which usually is on the left-hand side. For some people, it's on the right-hand side, but most times our heart is on the left-hand side, and it just sits just underneath our left breast, around that area. Now, the heart, look, I don't have to tell you that your heart is very important, very, very important. So now, apart from the heart, you then have also the lungs. So your lungs, which is the organ that you use for breathing, is also sitting right there, both sides towards the back on that side. Then a little bit in between the two lungs, you have big, pipes. These pipes are the pipes that will carry your air or carry your blood or carry your food. So you have those pipes sitting in the middle there. And then any area in between this space, you can have, pain emanating from there. If you then go backward, then you see something that protects and wrap around the chest, which is the bone, which we call the scapula. It's more like, the bone that sits just at the back to protect the chest. Now, let me say something here. In any part of the body that you find what they call flat bones Flat bones are bones like your ribs. They're flat. They're not the bone. They're not like the long bones, like the bone of your arm. They're flat. So anywhere in the body, like your skull, is a flat bone. You know, anywhere in the body where you find flat bone, like the scapula that I talked about earlier on, it means that there's a very important organ in that area. And those flat bones, they wrap around important organs and protect them. That's their function, to protect. They do not actually, they protect and they give the shape to some extent, but the major function of any flat bone is to protect. So you have the ribs that protects your heart and your lungs, okay? In between the ribs, you have what they call the manubrium, which is the bone, the breastplate, where there's a plate that's sitting right there, top of it. So the reason why I've talked about all this is for us to know that anything that is wrong with all these organs or this structure that I've talked about can lead to pain in the chest. Now, the chest is important because we said the heart is there. So if you have a pain that is emanating from the heart, especially like we got to know from some of the the teachings that we've done in the past, if somebody has a form of myocardial infarction, which is heart attack, there will be pain from the chest that will be coming from the heart. And like it was said by the expert that came that day, time is of the essence. You cannot wait to have pain in your chest that is related to your heart, like heart attack, and you wait, because the longer you wait, the more cells of the heart that will die. Okay, you don't want that to happen. So in such cases, you need to see a doctor immediately, immediately, because that pain needs to be arrested. That destruction of the cells of the heart needs to be arrested, and that arrest has to happen like right now. Okay, so that we can't wait till next day. But how do we know whether this pain that we're having, whether it's the chest pain that is related to the heart, or the one that is related to the lungs, the one that is related to the ribs, the one that is related to the muscles, the one that is related to the skin, the one that is related to so many things. And again, the diaphragm, which is the organ that support, at the base of our lung here, which is the one that we use when you take a deep breath, it's the thing that flattens, and then when you breathe out, it's the thing that goes up. It sort of separates the abdomen from the chest. The diaphragm, you can have an issue or problem with the diaphragm and it can give you some pain. In fact, the pain can emanate from the abdomen, irritating the diaphragm to cause the pain that you have in your chest. So all these things, they're characterized by various, presentations. So let's take it one after the other. We talked about the lungs. Can pain come from the lungs? Yes, it can. What sort of pain comes from the lung? If somebody, for instance, has pneumonia or you have an infection in your lung, because the lung is inflamed, the lung is sick, pain can come from that part of the chest. So it could be towards the back of the chest. Okay, such pains are usually worse when you take a deep breath, because then you stretch your lungs. Okay, it doesn't mean that's the only pain that comes when you stretch your lungs, but that is one thing that can cause a pain that is related to the lungs. Sometimes people can have a clot. These days we've been talking about rare form of clots that comes from some of the vaccines that we're taking, and such clot can move anywhere. It can land in the lungs. When it lands in the lung, we call it pulmonary embolism, which is a situation where this clot, the fragment of the clot, is going to block some area in the lungs, and so it can come with pains as well. So when people take a deep breath, we call it pleuritic chest pain. So it's the pain that comes when you take a deep breath. So you breathe in and then you feel the pain. Now there are other things that cause this. I need to make it very, very clear so that this is just an education, kind of a session to educate you about your chest, but don't assume that things are right. But such pains, of course, if it's a pulmonary embolism, it's an emergency as well that we'll need to do something about, because the clot has to be, we need to burst the clot. There are clot bursting treatment that somebody who has that needs to take. Otherwise, it can lead to a bad, ending in the body. So if you have such pain, they're quite important for you to see somebody like immediately, as soon as possible. Okay, now let's start talk about the heart. For the heart, The pain in the heart is usually on the left. Like I said, most of us will have our heart on the left. A very few fraction of us will have it on the right. People who are dextrocardia, like they call them, the heart on the opposite side, majority of them would have known by the time they are getting to, adulthood. Now, a lot of the pain that people will have in their chest, a young child will not have, in most cases, a young child will not have pain that is related to the heart on the, because the heart is still very, young and it's growing, and a lot of problems start with old age, you understand? So the heart gets to have problems when you are age about, 35 these days, I'll say, but usually we say 40 and above, you need to be careful. 50, 60, 70, chest pain related to the heart are commoner in such age group than when you're talking about somebody of, say, 14 years old, 15 years old, 20 years old. Those are young heart, and usually things that will happen in such cases are majorly they're related to things like in the lungs, where they have clots in their lungs and things like that. Okay, now it's important for us to know that if you then have a pain that is on the left-hand side, whether it's sudden, whether it's gradual, if the pain is worse when you're walking, you're going upstairs, you feel breathless, you're walking short distance, maybe you've gone to Blanco, you can't walk the length of the hall. By the time you're walking, you get breathless, or you're climbing the stairs, you get breathless, or you're having palpitation. Palpitation means your heart is, pounding and you could feel it. Ideally, your heart is doing its job as you are now. If you don't have a problem with your heart, you don't feel it, it just automatically keeps doing what it needs to do. You don't feel it. But when you feel your heart pounding, then that's what we call palpitation. So if you have palpitation, your heart is pounding, and then you have other of these symptoms associated with it, you need to get somebody to see you ASAP. If you are known to have high blood pressure, whether you're on treatment or not, if you're known to have high blood pressure, things like diabetes, your cholesterol is high, you have family history of heart problems, an obese person, all these are risk factors. If you smoke, they're risk factor that will predispose you to heart condition. So any chest pain in such people needs to be taken very seriously. Okay. So you need to see somebody ASAP if you develop pain and you are in this category of people. Okay. Now, so the pain for the heart is usually on the left-hand side, like we said. A lot of the time, the pain will radiate to the neck, to the left side of your neck, or to the left side of your arm, purely because, like I talked about, these big arteries that is coming from the heart. The one that is coming from the left side of the heart, one of them will go this way. The other one goes to your, it just splits and goes into your arms. So if you have pain going to your arm, it's going to either of the arm, but majorly the left side, or it's going to your neck. And then this pain is related to exertion. You're walking, you have the pain, or you're breathless with it. You need to take those pain very, very seriously and be careful about this, because you need to see somebody to right now. You might need to have your heart tracing done. Sometimes you might need to have an echo, something, a picture that will look inside your heart to make sure that everything is fine. Okay, now, majority of the pain that people have, they are not heart-related pain. A majority, I said that again, majority of the pain are not heart-related pain, especially in age group of about 50 and less than 50 years of age, purely because majority of the pain that people will have will be physical. Like I said, the muscles are there as well. You have your muscle. So when you lift something, whether you lift something awkwardly, okay, or the way you carry things, you can develop a pain because you can bruise your muscles. Just like you going to the gym. You have been in the gym for a very long time. You go on and then you just pump up and do things. You have pain the next day because your body produces some substances, which can irritate, around the muscle to cause pain. So you have to, if you're very physical, you're very active, and you develop pain like this, then it might be something to do with your muscle, okay? But like I said, characteristically, if the pain is on the left-hand side and you've not been doing anything very physical, even if you have done something very physical and you're worried yourself you're worried about it, you need to get somebody to see you ASAP. A pain that is coming from the muscle is a pain that I can reproduce when I press on it, or when you move, the pain will be worse, or when you press on it, the pain will be worse because the muscles are there. And then when you press on the muscle, you irritate the muscle the more, and then you feel the pain. And then because the tendons and the ligament that moves our arm or moves our body, when you move them, they can cause pain. Okay, and then that's in a way, a simple way that I can actually, from the story that you've given me, I can actually, delineate whether this pain is something I need to be worried about or something that I could not, I could still sit up a little bit for some time to, to see. Any of this pain, if they're associated with shortness of breath, they're very, very important. Shortness of breath and pain means that the pain is likely coming from your lungs. Then we need to find out what it is, whether it's an infection, whether it's a collection in the lungs, like you can have fluid collected in your lungs. Some people fall, they have blood collected in their lungs. A lot of the time, when this happens as well, the ribs can be cracked. People can have cracked ribs, and then they have pain. And then when they take a deep breath, the pain it hooks them because the pain you stretch your ligament, your ribs, it stretches the ligament, and you feel pain, and then you can't breathe, and then you don't want to breathe a lot. Such cases can be, when you see a doctor, they can tell you clearly because there will be points of the rib that is broken. I don't need to have an x-ray for this one, purely because, like I said, ribs are not my worry. I'm not worried about your ribs. I'm worried about the lungs that the ribs is protected. The ribs we heal. You understand? So if you crack your ribs, I'm not overly worried about it. As long as it has not punctured your lung, I'm not worried. And there are no multiple fractures. Like if you have a lot of fractures on the ribs, the ribs can then start flaring and going all over the place. And then you're not, you can't breathe well in that case. So, but by the time you see the doctor can tell you that. And that usually happens in a case where you have a trauma. When somebody gets their chest being, hit by something, that's when you have such a condition coming up. How was the time? Okay. So we have a few more minutes to round up this session. And so having said that, you can even have a problem in your stomach, and it can present as pain in the chest. For instance, somebody who have high acid collection in their tummy, if you have what they call gastritis or peptic ulcer disease or things like that, or reflux osophagitis. Sorry, I'm throwing all these big grammars, but I'm going to break them down. Reflux osophagitis means that a situation where some people, when they eat, you see your acid, if you put your hand, your stomach, if you put your finger inside your stomach, if you have the opportunity to just put your hand inside your stomach, it will burn your hand. It's really, really acidic in the stomach. Now, when you eat, the food is supposed to go through the food pipe called esophagus, and it goes in there, gets into the stomach, get processed, and things go, whether protein, carbohydrate, whatever it is, gets distributed to the right place where the body would need it. But in certain cases, there will be a situation where this food, instead of going down, comes back. So that's reflux, okay? And reflux esophagus is the food pipe. So you have what they call the reflux osophagitis. Osophagitis means that inflammation of the esophagus. Because of the reflux you're having, acid is coming back to your stomach, out to your chest, where your stomach, where your esophagus is, and then you have an irritation. And that will keep irritating that area if it continues, and then you can have pain. Such pains will happen at night, especially when you lie down. If you do anything that makes you lie down because of the backflush of the food, then you have such pain. So those are important things that we need to know. And this pain sometimes can be worse when you take a deep breath or when you exhale, because of the way that the diaphragm then works on the stomach, and the fundus of the stomach is sitting just somewhere there. Other things that can happen is for people who have problem with their gallbladders. Usually such pain is in the abdomen, but because they're very, very close to the chest, pains can be radiating to the chest, or if you have problem with your pancreas or things like that. So we need to be very, very careful of those. Okay. Now, the reflux esophagitis or things like that are something that the doctors would diagnose easily. They can give you treatment. Treatment is not so difficult, but you need to speak to a doctor. Okay. Now, the most important thing is we need to know what the red flags are when we talk about chest pain. So I've talked about pain. emanating from the heart. I've talked about pain emanating from the lungs. I've talked about those ones emanating from, tissues around or in between the lungs, tissues, underneath the diaphragm, and I've talked about the muscles. I've talked about the bones, where pains can come from. Now, it's important for us to know that if we have pain coming from your heart, you cannot wait till another minute. You need to get somebody. So if you have a pain that is just common, whether sudden or gradual, around your left side of your chest, the majority of the people, you feel breathless with it, is you don't want it to last for 15 minutes. 15 minutes to 20 minutes is the target. Such pain needs to be dealt with immediately within this space of time. Again, our health system, whether it's going to accommodate us to get you to see somebody within this period, is quite difficult to say. There's a treatment that needs to be given. I'm not here to talk about treatment. I'm here to just enlighten us about the pain, and then obviously for us to take the appropriate step as it's needed. Thank you so much for listening today. Now, while I talk about the chest pain, let me also quickly introduce, our training. We do training around the basic life support and advanced life support, immediate life support, which is actually licensed by the European Resuscitation Council. And it's important for us to know, enlighten ourselves about this training, because you don't know where it's going to become handy. People collapse everywhere, here and there. If somebody collapses around you now, do you know what you're going to do? What we do in this training is to educate people on what you need to do, enlighten you on how to keep these people alive. You only have 3 to 5 minutes before the brain goes dead. So if somebody collapses, you don't know what you're doing, whether it's your relative, whether it's your co-worker, whether it's your family or wherever. If somebody collapses, you don't know what to do, and then they're actually in cardiac arrest or things like that, and you don't know what to do within the space of this short time to help them, to keep them alive until somebody who can actually take on from there comes to you. If you don't know what you're going to do, a lot of people die because of this, needlessly. And then what we've been doing in Monitor Healthcare is to do a training every last Saturday of the month or every last Thursday of the month. You can actually look on our website. If you go to monitorhealthcare.com, that's monitorhealthcare.com. Go in there, go to services, then you can see mirage of what we do. But if the one you're of interest to you is the training, and then you go to the resuscitation training. So the resuscitation training, you can book yourself on this training. We occasionally run some promo. I think the promo just ended, but if you keep an eye on our website, keep an eye on, follow us on this channel, and then if we have promotion, you can join, or you just join us as it were. You will learn a lot, and I promise you, you will do. Okay, thank you so much. Enjoy your weekend. And I'm sorry that we couldn't come on with the program that is supposed to run today, but we have another program for next week, and it's quite exciting. We're having, we're going to talk about the nurse, the home nursing care, and we have somebody who is really experienced and